At this time, I wanted to introduce our next presenter. It is Kelvin Yam. Kelvin is a clinical pharmacist, health informaticist, and digital health strategist. He is a Doctor of Pharmacy graduate from the University of Waterloo and a Master of Health Informatics graduate from the Institute of Health Policy, Management, and Evaluation at the University of Toronto, which is in fact a vector recognized program. Kelvin is applying his passion for healthcare innovation and agile thinking in his role as Senior Policy Advisor in the Information Management Policy and Strategy branch within the Digital Health Division of the Ministry of Health, where he is responsible for the innovation portfolio of provincial health data, governance, and strategy. In addition, Kelvin practices part-time as a clinical pharmacist specializing in pharmacogenomics and personalized medicine with an interdisciplinary team. So Kevin, as you can imagine right now, Kelvin is a very busy individual, as you can well imagine, and we are very delighted to have him here with us today to present on boiling the ocean and why it's sometimes necessary to tackle complex problems, a case study in health systems innovation. Welcome, Kelvin.
All right, thank you, Melissa, and thank you, Joanna, for organizing this. It's really a pleasure to be here. I'm a clinician. So as Melissa said, I'm a clinician by training. I am a registered pharmacist and a recent grad of the Masters of Health Informatics program. So hello to any of my fellow colleagues in the field. So really, the focus of my presentation is talking about change in complex systems and the role that AI and machine learning can play in this type of environment. So in terms of my background, Melissa already sort of gave you a brief introduction, but I'm a registered pharmacist in Ontario. My current role is as a Senior Policy Advisor at the Ministry of Health, working in the Digital Health Division. So some of you may have heard of the Ontario Health Data Platform for COVID-19. That's work that our branch is leading. Just this morning, actually just right before this meeting, we had a Joint Ministers Roundtable session with Dr. Jane Philpott, who's the Special Advisor. We also worked, we were also with very senior executive leaders in the health industry and across research and other sectors. So it really is a very exciting time to be working in healthcare. It's a very exciting time to be in the AI and big data field. I can say that in my experience, healthcare has always been sort of one of the last fields to benefit from this type of agile innovation. And that's because of, largely because of complexity and because of healthcare being one of the most regulated and perhaps personal industries. And there's a lot of sensitive data that requires protection. There's a lot of policies that were built for a different time, but with very strong and very well-intentioned principles, such as privacy, security, civil liberties, and I think one of the challenges that, a lot of the more technical people perhaps, will face in their careers as AI professionals is, understanding how you can assimilate a technology into a particular sector and how to explore the cultural fabric within different industries and sectors and the values that those sectors carry forward. So in healthcare, not only is there a focus on innovation, but there's also a huge focus on sort of patient rights and patient autonomy, change management. There's a focus on process. There's a focus on, what is in the best interest of the patients, on ethics. And I think that, a lot of those principles do apply to other industries, but I think it's really important to approach whatever problem the AI or machine learning solution is intended to solve, by critically analyzing, like, what are the cultural barriers, why are we here today, and how do we move forward? So in my experience as a pharmacist, it's really provided me with a grounded understanding of the healthcare industry, and sort of allowed me to crystallize, where I think the opportunities are, where the use cases are. As an informaticist, really, that's broadened my knowledge in terms of design thinking, knowledge translation, and quality improvement. So those have been strengthened by my experiences in digital health and in consulting. And as a strategist, which is really, really tightly related to my role currently at the ministry, it's really looking at the entirety of the system. And given that systems resist change, you really have to think about, what at the policy level would resonate with the most people, how to apply those insights at a more tactical or granular level. And how do we work towards transformation? Like, the words transformation and disruptive strategy, are often, used as terms that characterize innovation. But, those terms alone are meaningless unless it's followed by action. And I think that, as technology evolves, I think, thinking about the societal and the ethical implications, and thinking about, how that technology is framed in the context of culture and health, and operations, is really important. And that's really what led to my interest in terms of branding. I think that branding is less about marketing and more about strategy. I think that when we look at the most successful companies today, there's a very clear, recognizable brand. Trust is built on brand. Brands are built on track records of success. Brands hold values. Brands deliver, something that is intangible but speaks to us. So, for example, in the project I'm working on, for the Ontario government, governments carry a certain brand, and governments, arguably carry a brand of trust. And that trust makes it actually, in some ways, amenable to innovations. Now, there are other barriers, of course. In the public sector, there are bureaucratic structures that make it sort of difficult sometimes to accelerate these initiatives, but we live in uncertain times, and I think the COVID-19 crisis has really brought us forward in helping us develop more agile methods, even within the public sector. And there's a lot of interest, there's a lot of goodwill in being able to move forward. But I think, the thing not to be underestimated are perhaps, the softer side of technology, and the communications and the branding, and the strategy and the framing of all of that is equally important, if not more important than the technology itself. So I'm just going to give you a bit of a primer on the COVID-19 health data platform and some of the work that I've been doing to date as someone who's in an AI complementary field. So in terms of the impetus for this health data platform, as you can imagine, when the COVID-19 crisis hit, there was very little we knew about the disease. It was so new. And so our clinical communities and our research communities came to government and said, hey, look, like we're dealing with a pandemic right now with very little information. We need insights that are actionable and that can be developed in a timely manner. We need to improve our analytics capacity so as to serve as an early warning system, or to be able to optimize the way we allocate resources, to be able to predict and manage outbreaks, and so on and so forth. And this makes a lot of sense when you think about Ontario as having very rich, but unfortunately potentially siloed health data sets. And the diversity of Ontario data, and the fact that we're all under a publicly funded healthcare system actually makes our data very valuable, and makes our data sort of applicable across both local and perhaps even international jurisdictions by virtue of having representative data. So in terms of what this health data platform is intended to achieve, it's really designed with the end users in mind. So if we look systematically at health data platforms that have been successful across jurisdictions such as, France, Germany, such as the UK, such as Finland, you'll see that all these health data platforms are designed with the end users in mind. So it's important that we don't take the research and the technology outside of the domain. We need to really approach this with sort of, social license, co-design, shared ownership in mind. Because, even if you design the most optimized algorithm, it's really not going to do anything if people don't believe in it, if people don't understand it, or if people felt like they didn't have a part in it. So, some of the outcomes that our decision makers care a lot about, and by decision makers, I mean policymakers, I mean clinicians, I mean, patients themselves, include testing results, death rates, the location, geolocation prediction data, hospitalization, and information about sort of movement, demographics, how different risk factors can be applied at a more personalized level, and how sort of policy decisions such as social distancing or relaxing of social distancing measures sort of can be more fine-grained rather than coarse-grained. And so the environment that we're trying to build is one that's not only based on trust, but will also allow for sort of perhaps the largest linkage of data sets, of health data sets within Ontario to date. And, a lot of this relies on, technological capacity, such as, security, but a lot of this, in addition to technology, is really focusing on the policy. So if you talk to, the decision makers in the data space, the biggest barrier is not the technology itself. It's actually trying to overcome some of those policies that were perhaps built for a different time, and understanding how we can fix those data gaps, and how we can make sure that that data can be linked in a way that's timely, that's near real time. And I think a really good example of a company that's been able to do this in industry is Blue Dot. So I think that the lag time that their like the lag time between what they can detect and sort of, I guess, the real time sort of development of the data is something like 15 minutes. So they're really close to in being able to get insights on real time. And I think that's something that's very aspirational, because I think there's a proactive side of predictive analytics, but there's also a more reactive side that may have to do with sort of allocation, resource allocation. But the proactive side is really where we're going to get the most bang for a buck in terms of being able to see, look at flight patterns and see, where we can predict the outbreaks will happen in which groups. So it's really important to balance those. And as I said before, I don't think any of these outcomes that we want to see, such as how the virus is spreading, minimizing risk to vulnerable people, how different subpopulations may be affected differently, how we can plan for outbreaks, and how we can flag these pre-symptomatic transmissions will be helpful if we can get to the decision makers themselves and see, because sometimes I think that, machine learning can give you very, sort of abstract results. And in healthcare particularly, we know that there's sort of a trade-off between conventional research methods and machine learning, where, AI and machine learning can, be a lot more helpful and perhaps be a lot more accurate in certain circumstances. But with the trade-off that sometimes it's not always explainable. And I know that, explainable AI is a whole emergent area of research, but nonetheless, sometimes this is where understanding the nuances of the domain is really important, because there are certain variables of interest that are more important to different decision makers. So, and there's also different variables that we working in the health system are able to change, and certain variables we aren't able to change. So the basis of correlation alone does not necessarily translate to meaningful outcomes. It really does require sort of engagement and co-design with the end users to figure out something, that people will actually use and implement, and is practical. So that's sort of my takeaway when it comes to, dealing with new technologies in this sort of complex environment. So these are just some of the, these are some of the projects or themes of projects that we've received from researchers, including vector researchers. So we've been told by the researchers that, that we might be able to improve health outcomes, resource allocation, and drug and vaccine development through research projects that focus on disease surveillance, case prediction, social distancing, mortality risk, monitoring system stress, monitoring the supply chain, and in the longer term, facilitating drug and vaccine development. So we know that there's a lot of promise, but the question is always, how do we build the right policy, enabling policy framework, and establish, and I think the most important thing for this project, aside from developing a successful big data platform and overcoming those policy barriers, is actually thinking about how we can develop this social license and engage intentionally with the people who are expected to be the beneficiaries or the end users of this platform. And so, then the complementary side of this technology is actually a whole, public stewardship and data governance model that looks at how can we as a society manage this big data in a way that benefits people, and considers all the different interests that different populations may have. Recently there's been a lot of talk about diversity, inclusion, and equity. And I think that, the machine learning community has always been aware of these concerns, but I think more importantly than ever, the attention is focusing on, how do we do that not only from a technology implementation standpoint, but at a more macro level? How are we talking to the right people? Are we asking the right questions? Are we truly understanding the data behind the data? So those are all the kinds of questions that we're grappling with as we're tackling this project. So this schematic just kind of shows the existing health data climate within Ontario, and the center figure is really just an abstract representation of what the platform's trying to accomplish. So at the top, you'll see these are the different kinds of data that are already existing within the healthcare system. And, a lot of the issues that you might flag there are questions about, data quality. Is the data linkable? Is community data complete? What is the frequency of the data feeds we're getting? And those are all issues that we're grappling with. But below below data collection, I'm just going to call it machinery that goes behind the development of this sort of data repository that seeks to risk manage the different kinds of data coming in. So with personal health data, it's subject to a lot of regulations in Ontario, primarily the Personal Health Information Protection Act. And in that act, we're bound by certain legal frameworks. So the act was established in 2004. Obviously, the world was a different place back then, and so there were constructs of sort of de-identification, that was set at that time, and we really have to, in healthcare, we have to look at population health data, hospital data, and researcher generated data, and perhaps like more emergently consumer generated data. And the challenge has always been one of harmonization, and secondly, I would say, of risk management. In terms of risk management, because we're bound by the construct of de-identification, and what this has mean in a traditional context versus what this might mean in a machine learning context, it's really created a lot of barriers, and it's something that we are trying to work towards, because I don't think any of us would say that our personal health privacy is not important, but at the same time, I think we all understand, especially with the GDPR and with the newer data protection regulations and legislation across the world, that in the world of big data, the triangulation of several data points can be used to identify an individual. So de-identification is not as simple as the removal of direct identifiers, nor is it as simple as once the data is quote unquote de-identified, that anybody can have access to it. And so, you know, managing that tension has been the biggest barrier in terms of health AI, because, you know, people care about privacy, but at the same time, we care about innovation. So the question is always, how do we appropriately manage risk? And so we're working with our partners at the Schwartz-Reisman Institute for Technology and Society, which I know Dr. Jillian Hadfield, who's also a Vector affiliate, and she's been leading a lot of great work. She and her team have been leading a lot of great work on the development of a legislative and sort of regulatory framework that would apply in the health AI context, you know, while still encouraging innovation. And I would encourage all of us who are in the field to really look towards what those solutions would look like, because the future of AI is not going to work without the humans there to want to support it. And so we really have to think deeply and critically about, you know, regulatory reforms, and we've heard about some of that with the self-driving, you know, automobiles. But I think that, you know, the problem will only get bigger, and there's a lot of problems that need to be resolved, you know, before any of this technology can be scaled. And I know that governments across the world and industries across the world are really, you know, grappling to deal with that. And I think the really smart AI companies will know that in order for there to be social license, and in order for there to be like any meaningful adoption, that these policy problems and let's just call them people and society problems need to be addressed in parallel to advancing the technology itself. So this is just a summary of some of the changes that we're proposing with this platform, really to support the advanced analytics capabilities rather than traditional health services research. And we know that healthcare is a complex environment. Obviously, lots of data is being generated in lots of different places. The question, you know, is always, how do we harmonize that in an ecosystem in a way that makes sense, and so in a way that where optimal value can be derived from it. So one thing that we're doing is we're increasing the scalability of these high performance computing systems by capitalizing on sort of made in Ontario innovations and in advanced computing facilities, partnering with academic institutions, with people with expertise, you know, in an interdisciplinary team. You know, we're really trying our best to, we've heard from our researchers that ethics approvals and, you know, peer reviews can be time consuming. So we're trying to find process innovations there. We're using that government brand of trust to be able to, you know, mitigate some of these, you know, risks around accountability, which has translated to sort of time delays in being able to get those insights to practice. And we've designed a model that's privacy centric, but at the same time trying to balance that with expediency, usefulness, and access. And during the time of the pandemic, we're providing researchers and data scientists with access to the data at no cost, because we really do value the ability to generate these insights in a timely manner and to sort of crowdsource our knowledge and deep talent pool across Ontario. So I'm just going to finish with this one slide, which I think is really essential for, you know, anybody in the innovation space to truly understand. You know, I think that, you know, one of the biggest barriers to innovation is we're always going to be bound by the status quo bias. Like I said, systems resist change. Complex systems, inputs don't equal to outputs. So a lot of the times, you know, if we think from the present forward, we end up missing the bigger picture, and we end up just reacting to trends without really trying to understand the convergence of trends and how different fields will sort of converge. So I think what I would advocate for, and I think the schematic shows it really well, is sort of this future back approach, where we look at where we think policies, trends, and systems will converge 10 years down the road. And then we try to work backward from there and understand, you know, based on, I'm not saying that we'll understand entirely or can predict the future, but I think, you know, it's worth investigating where you think those opportunities will be. So for example, you know, how will social sciences, how will ethics, how will civil liberties and AI converge? How will the different sectors respond to this technology? And then that might be really helpful in being able to identify where those opportunities are and where you should direct the focus, then the strategy of how you can win that game can come next. But first, you really have to understand, have a very clear vision and idea of where systems are going to evolve, and then work backwards from there, instead of just jumping onto the bandwagon of, this is the latest technology, or Amazon is doing this, so let's copy that. I think it's really important to start with the broader picture in mind, because until you understand what that system's evolution will look like, we'll always be one step behind, and we'll always be challenged by barriers that we haven't been able to resolve because we haven't thought about them. So that's sort of my speech. Thank you so much for your time, and I'm happy to take any questions. Thank you.
Thank you so much, Kelvin. And that was a fantastic place to end. You've really described a very complex, multi-stakeholder environment. And I imagine that there are a lot of difficult trade-offs that have to be made in this context. We have about 20 minutes left. So what I'm going to suggest we do is defer questions and move to the panel discussion, because we do want to hear from a couple of other speakers. And if there's an opportunity at the end of the panel, we can certainly revisit this conversation, which is really, we should have devoted much more time to, given its complexity. So I'd like to thank you, Kelvin, and we're going to transition to our panel discussion, and I'm going to hand over the floor to my colleague,